your director earlier today. So of course there's been flooding. But what do we expect next? Probably an outbreak of waterborne diseases. So today we are fine, but tomorrow we may be responding to waterborne diseases, cholera, diarrheal diseases and others. So health is ever dynamic, so you need to be eternally curious for you to be in the health space. You need to read a lot and research a lot in the health sector. Health is not just about disease. We are talking about, health systems. We talk about health financing. We are talking about the geopolitics of what's happening in the global health space, for example. There are so many things around health. It's not just about disease. So you need to be able to constantly read and research so that you're able to be up to date with what's happening in the health field. The basics of journalism will still apply. How you tell a story, how you do your news gathering, all of those things apply. You still have to go to ground and talk to people. You still have to go and interview. Journalism apply, only that in this case, they will change and apply to health. And then health has a lot of jargon, so it means you really need to be constantly updating yourself. And luckily for you, you come at a time when you can just tell Google to define something for you and you're able to understand. Or you can tell, AI, what does this mean, and they're able to understand and be able to simplify the research for you. And like back in the day where you needed to go to a library, look for a particular book, and sift through pages and pages in the book for you to be able to get the information. So you come in at a time where all of these tools are available to make your journalism, your communication even better, so that as a practitioner, be it in health journalism or any other journalism, you're able to thrive and shine in that kind of thing that you do. So I'll leave it there. Thank you very much.
Okay, thank you very much, Madam Mercy Coril, for those sharing those insights. Ametueleza kila kitu about the health communication and the universal coverage. Walio na masikio wamesikia na wanaotayarisha maswali wanatayarisha kumuuliza. Asante sana kwa mara ya pili. Okay, to the next, may I take this chance to welcome Mr. Francis Mtua to share his insights on the same topic concerning the health digital communication and universal coverage. Thank you very much. May you welcome Mr. Francis Mtua.
Thank you very much. All the protocols observed, good morning. Hope everyone is well, and I would like to take this opportunity to appreciate our director. I don't know where he has gone, but I can see his team here. Thank you for organizing this. Of course, mentoring our students or our future generation is very important, because life is like a moving vehicle. Every day, of course, we have things to put aside. There are those who are coming on to take over from where we are living that journey. So, again, I would like to say my name very well. I've had the majority of you call Mutie, Mutua. My name is Francis Mutia. I work for the Ministry of Health, a division called Health Promotion and Education Management. In this division is where we are mandated to ensure that whatever goes out to the public from the government is very well effective. It is actionable, it is adhering to the government protocols, and of course, it is for the benefit of the common mwananchi whom is our target audience, ensuring that we address the issues of behavior change, advocacy, risk communication, because we know we have a lot of people trying to do the same job like us, but we need to ensure that we all aligned to the same path, so that we don't confuse our end user. And so for today, because we are here for digital health discussions, it is very important, because I've heard majority of you are either journalists, or you are upcoming journalists, or you are a student who is practicing in terms of digital space. And this is your opportunity to know what is there. Of course, your lecturers has advised you about how you become a competent communication either officer or call them. But by the end of it, we are looking at the future. What do we need to achieve? How do you need your people whom will give them information see you? Will they hear you or they will just ignore you? So this is the first, and I'm happy. And so going straight to what the agenda was, of course, I don't know, Barasa, you said we go up to the fifth questions, right? Okay, so my first concern was about how has digital technology changed the way health information is shared with the public. Of course, we understand and we have had Dr. Masi has said during COVID-19, we had a lot of challenges. People were barred from meeting with each other or accessing certain services. But now it opened our minds, our eyes, and it brought a lot of opportunities for us to come up with digital innovations to communicate, to continue giving out information in a way that it will reach out to our target audience either faster or efficiently, or somewhere where you can't go physically, you can share your information through digital channels and reach your target audience very well with even minimal resources. And these are the opportunities that we have seen in healthcare setup. We know that we have some of our target audience who don't have access to these digital channels. But the government of Kenya, through the Minister of Health, in terms of health-related information, I don't know whether there's somebody who doesn't know the name or you are community health promoter from where you stay. Anyone who doesn't know their CHPs, we call them CHPs, community health promoters. Ama yule daktari wa pale kwa kijiji, mnamjua ule wako wa hiyo area mali unaishi? Yeah? Okay, majority in urban area, it might be challenging because the CHP might have visited your house and maybe you are here. Yeah, so that's the reason why sometimes you may not know you are CHP, but kule ushago, si lazima kuna wenye unasikianga either mom or shush or dad wakisema daktari wa afya alitutembelea leo akaangalia kama tuko na choo, kama kila kitu iko sawa, kutupima pressure, vitu kama hizo. So we have this our healthcare heroes across the 47 counties, and we are using them as one of our media or one of our channel to ensure that even those who are at the grassroots level access information through this platform that we are sharing. So our CHPs are equipped with gadgets, more specifically a smartphone. So from the national level, we are able to pack the information, then share to the county level. Sharing the information to the county level, of course, now county communicate to the sub-county team up to the now community level through digital platforms, among other channels that we have so far. So these are one way of ensuring that we reach everyone. And I'm also happy to see in our midst, we have interpreter. We must also acknowledge that, because ensuring that all our audiences are inclusive and there is no ubaguzi. Everyone is reached with the information that we want to share. We must employ all avenues to ensure that no one is left behind. And that is the goal of universal health coverage. So ensuring that we have interpreters, we have information that is meant for the people who can't see or read. we must ensure that we utilize those platforms. And through now the students who are in this area today, of course, it is your opportunity to ensure that you also venture into those strategies whereby no one is left behind. Of course, you are here, either physically you are very fit, you are able to see, you are able to hear, but there is somebody out there, hana macho, okay? Haezi sikia. So how are you able to assist that person to also feel like you? Okay, so that is an opportunity that we should also look at. Then again, looking at what role does communication play in improving healthcare services in Kenya? Of course, as I have mentioned, through our networks of CHPs, our healthcare workers, those who are providing the information, we can build trust, okay? We can help people understand what are we trying to communicate. Then, of course, we are able to explain or make our target audience understand what is the government saying, which services are available in my area. So through these digital platforms, we are able to give this service. Of course, because now we are shifting to technology. Technology is shifting, and almost everyone is, I don't know whether there is anyone who is here and has no either smartphone or access to internet. Anyone? Apart from the student, I know students, maybe they access that during their either library sessions or like that. But I understand that here, majority of us, we are using smartphone, but these are areas where we can as well get the information that is being shared from our government structures, and we are able to change the behaviors as instructed. So we are encouraged for behavior change, and also the issues that we need to follow, the guidelines that we need to follow, the behaviors that we need to change, what to do, what not to do. So we are able to get all that through our fingertips. Then, of course, how can digital platforms help people access health services faster? Now, we have even AI. I know majority are very afraid about AI replacing human interactions, but we have to enhance, because it has come. How can we use it to do whatever we want to do with this technology? So we are able to use those platforms to encourage or to communicate timely, accurately, and ensure that we reach everyone. Of course, through the Ministry of Health, when you want to communicate something to your target audience, there's a process that you should follow. Of course, there's issues that you also need to consider, ethical consideration. Don't share information anyhowly. Information that is not approved can put you at a danger. You can be sued by sharing information without a consent. I don't know whether you know that. Majority rush taking photos or recording people without their consent. That person might sue you, and you end up being in trouble. So you should be very careful. When you want to communicate anything, let's say, for example, in health, as I said, there's a protocol. Of course, you have to understand the needs of my audience. What does my audience need? What is the issue that we want to address? Is there data that will support the issue that I want to address? So you have to follow that guidance. Then after that, now you come and identify now your audience. If it is pregnant women, if it is youth, if it is people with disability, understanding their needs, of course, now it will help you now know the message or how you'll pack your message. Then after that, you draft your prototypes or your information. Who received a message from Red Cross saying that move from higher ground if you feel you are safe, something like that. okay? Almost everyone. So that is one avenue of using digital platforms to disseminate information. So we partner with these organizations like Red Cross, HAMREV, UNICEF, to pack that information so that when situation comes, we are able to communicate at that time and ensure that our people get that message. I don't know, those who received that SMS, was it pleasing to you? Was it actionable to you, or it was confusing? Yeah? It was up to the point, isn't it? So at least if it, you received it, of course, and you have somebody at your home. Pengine si kila mtu ako na smartphone kule nyumbani, si ndio? So you have received that message from Red Cross or from the Minister of Health or from any organization. Are you able to share out that information now to the entire people who are not having access to that information, okay? So those are some of the campaigns that we have done. We have even health. Those who are expectant or those who are looking to be future moms. Of course, when you visit any healthcare facility in our country today, more specifically for public, you will, if you are a mom, you will be advised. There is a platform here where you can enroll for free to get health information either every day or weekly, advising you, like if you are pregnant, how can you take care of that pregnant? Giving you reminder. If you are supposed to take high fast daily, you get a reminder. If your clinic is due, you get a reminder. Such platforms is now where we are approaching, because we understand we have a lot of work to do. But how do we ensure that in your work, how can we work together to ensure that service or that behavior, how can it influence you so that you can be healthy every time? So we have even WhatsApp, we have bots, we have AIs, okay, where you can just click and get information from the Minister of Health. If you visit most of the Minister of Health social media platforms, you are able to access all this information. And we are doing this in collaboration with other with our partners. Lastly, how can students in communication contribute in improving healthcare awareness through digital platforms? Yeah, of course, we know students are very creative, especially when you tuko hii rika. Tunajiita Gen Z. Sijui ingine ni gani, hii ya 200 something kukuja hivi. Very creative, si ndio? Millennials ni yenye konyume ya Gen Z, si ndio? Alpha. Yes. Now using your smartphone, you are able to create content. So again, when you are creating content, yes, it is very good. There are platforms that you can publish your content and get paid. But is your content good? Is it adhering to the protocols that are there? Okay. So we have received most of content creators who have partnered with the Minister of Health to come up with content for health. And you are all welcome to do this. Our essence is to ensure that we reach out to everyone. And also with this space of technology, we have to ensure that we utilize all these methodologies. Those videos that you record, maybe you are advocating for something or for health eating, drinking water every day, just through your phone. There is somebody who is very busy, but you recording that message and sharing out to your channels, that person will get a reminder. Oh, I can see a very good message here saying that I should take water every day. Because I was busy, now I have read this message and I will change that behavior of not taking water and become somebody who will adhere to health issues. Then again, we are able to design some of the best graphics, of course, we have visited some of the booths and we have seen very good items there being developed by some of your students. And that is what we are encouraging young people to do. What are you able to bring to show people who have no access to either digital platforms or who are at the digital space to get that information? So if you design something that is very appealing to my eyes, of course I will be able to read. And don't forget that when you are creating all those content, you have to adhere to the protocols so that you don't confuse the public, don't spread the rumors, okay? Don't bring myths that people will, when everyone is speaking something on social media without any guidance, of course, the end goal is to confuse everyone. Mbona nilisikia wakisema hivi, naona watu wengi wakisema namna hii, sasa tutafuata nani? So, of course, you have to adhere to the protocols. Sometimes you see people creating content. You are targeting somebody, maybe, for example, in Nairobi. The same content in Nairobi will be different from somebody in Kitui, for example, because the audience in Kitui understands better in their culture, okay? But in Kitui, of course, utapata kama ni una target youth, lazima upate ule youth anakaa mu Nairobi, si ndio? Kama ni kule mashinani, utatarget mtu mwenye huko mashinani. Si kuweka picha ya mzungu, si ndio? Thus, you will reinforce what you intend to communicate. Otherwise, let me stop there. I know we will discuss more, and I really appreciate for this opportunity. Thank you.
Okay, thank you very much, Dr. Francis Mtia, for the insights he has shared with us. So earlier on, I had received information that our Dr. Mercy will be rushing somewhere at noon. So before the doctor leaves, please, I'm requesting any student who has a question. I'm requesting any student, either you are... Okay, sorry. I'm requesting, if any student has a question, to pass through to Madam Mercy or Mr. Mtia, please share with me so that tunaweza ichukulia saizi, we deal with it currently. If you have any question, post to me, uniletee hapa mbele tafadhali. But before Madam leaves, I have several questions for her to answer before she goes. So Madam, that is the first question. The first question is, in your own view, how can Kenya improve internet access to support digital healthcare?
Can we use this one? Okay, it's okay. So thanks for that. I'm happy to take questions. If anyone would even want to ask from, the meeting, I think you can share with them microphone. So how can we improve internet access? Key, in my opinion, is affordability, because our internet costs, I tend to think, is a bit high, or really is high. If you think about how much you spend on bundles, especially if you need to download a video or images, it costs a lot. So probably one of the things is to make sure that it's affordable, it's mainly affordable, that anyone is able to access and be able to get that. And I say this because our own data, and even the data from research institutions like Reuters, show that in this part of the world, our media consumption is mainly audiovisual, where we want to see a video, we want to hear an audio, or we want to see images. So of course, those cost a lot if you're going to be using your bundles to not order, be able to access. So probably that's one of the biggest issues, because when you look at our connectivity, telecom connectivity, it's really good and spread out. the barrier to accessing internet would be in the issues of cost. And of course, when there's a downtime, we need to think about backup and redundancy. So options of government making sure that we have alternative sources like satellite access, particularly for the far to reach areas where telecom connectivity may not be the best. So satellite access would probably be one of the other things to really consider so that people are able to access the information. And when we think about digital healthcare in this case, from my perspective, I speak as a communicator, as a journalist, but also from Mutia's perspective is if you're to do telemedicine, of course, are people able to access? Are you able to see the doctor on the other end of the call, for example? Is the doctor able to see you? Because if you're complaining you have, maybe a swelling or a rash or something, are they able to see it? So in those aspects, so when you think about digital in this case, for the place where we are, it's in journalism and communication, but there's also the other aspect about, being able to reach people, being able to treat them remotely, or being able to consult remotely. So is that connectivity there?
Okay, and then I have the second question that goes, what risk exists when people rely too much on online health information?
Of course, it's harmful. And I would like to take the example of Ozempic and the skin bleaching that we see rampant online. I was seeing I think it was on Instagram, somebody was selling Ozempic from the balcony of their house. So one, if you trust such a source for such critical medicine, how do you know that that is legitimate medicine and not something fake that is going to harm you? Let's even start there. But of course, now there is the issue of accessing prescription-only medicine in ways that you should not, because if you think about Ozempic specifically, it's medicine for diabetes. It is not medicine for weight loss, only that one of the side effects is weight loss. But people are using it for weight loss, not considering what other harmful effects would it have. And we are seeing that coming up recently, of the harmful effects that people didn't know. So if you're diabetic and it's been given to you as a prescription, there's a reason why that has been given. But if you're just regular normal person who thinks they want to lose weight through this, what harm would it have to you? So there's that. So of course, relying fully on online for information has its direct harm in that it can harm you directly as an individual. From a public health communication standpoint, it can cause harm in society. So there's routine vaccination for children, and all of you being Kenyans have undergone that. Initially, it used to end up at 9 months. Now those vaccines are many up to 2 years plus. There's usually anti-vaxxers, people who are against vaccination, or people who are planting vaccine hesitancy, issues around the community. So if parents don't take their children for vaccination, for example, you start seeing things like outbreaks of some of these infections that had otherwise been controlled. The US last year had an outbreak of measles just because communities are refusing to vaccinate their children. What happens is it spreads, and the harm is that, one, a disease that could be eliminated is still with us. Two is that children, if they are not taken care of early enough, they may die. So, so it has a public health implication. Sorry for that. And then lastly, obviously, is that if you rely a lot on that information, there'll come a point where you don't know what is true and what is fake, because you're just fully relying on the information that is online. So it's good to have information online, but you should also go a step further and check who is the source of this information. Are they a credible source? If they're a credible source, you can listen to it. But if they're, somebody who's just doing something as an influencer through their balcony, then of course you're risking your life and the lives of others.
Thank you. And then I have the second last question. What future innovation do you expect in digital health communication?
What future innovations? You know, the generation that is here, the Gen Zs and the Gen Alphas sitting here and some here, things are changing in every day. We're seeing now, not in Kenya, but issues of, say, robotic surgery, for example. That's just in practicing medicine. Communication, the digital space is more agile and easy, you know, to do something about. So I may not have a finger and say this and this innovation is what we're expecting, but, you know, it's there. 3-4 years back, we didn't think AI would be a major thing that we are talking about. We are talking about, you know, incorporating it in how we do our work on a day-to-day basis, but now it's here with us. Organizations like mine, we have AI policies. I saw NMG the other day have theirs. So all of these things will continue being there. I cannot place my finger, but, you know, the future is bright, especially for the young and the creative minds that are coming up.
Okay, thank you, Madam. You have just talked about AI. How will artificial intelligence and technology change healthcare communication in the future?
AI is a double-edged sword. So on one hand, it will make things, it makes the turnaround time for doing things, you know, shorter. In that, a story you would have edited and done in, say, 1 day, you're able to do it in an hour. So it will make our work faster and better. And instead of doing 1 or 2 stories in a day, we probably will be able to do 5 or 6 stories in a day. So it will help us do a lot more content and put out a lot more content out there. The double-edged sword for me is the issue of misinformation, disinformation, and fake news, because AI can generate anything that you prompt it to. So we really have to see how that happens, but there is the silver lining in that there's room for people like you who are here, who will be grounded in the basics of journalism, in the basics of content collection, so that your space is in verifying, fact-checking, and giving the right information, and showing the true that is outside of AI. So there's a silver lining in that. There'll be room for everyone here to shine a lot more in the space of journalism, communications, and PR. Thank you.
Okay, thank you very much, Dr. Masi. So may I take this time to welcome Mr. Mtua, since I have several questions for you. So the first question is...
Baraza, but before you do so, because Dr. Masi Korir needs to leave, we have some few questions for Dr. Masi Korir from this end.
Thank you.
What is the... I'm Joseph from the Highway Secondary School. What is the government of Kenya doing to develop the digital healthcare system?
Let me put a disclaimer and say that I don't work for the government of Kenya. I'm a private citizen practicing journalism in the digital health space, but I know this particular government has been very deliberate on everything digital superhighway, digitizing how it does things. So there are some investments that have been done in the digital space, in making sure that we are well connected, fiber optic, and all of those complicated things that I may not understand. That, you know, we are well connected. That we have freedom of, we have freedom in this country. There are countries that I've visited, and for example, you can't use WhatsApp, you can't be on Twitter. Some things have been blocked altogether. So we have that freedom to be able to interact and engage freely, and freedom of communication, media freedom, and all of that in the digital space. So there have been investments. I may not have the details of that, Maybe Mutia would be able to know, since even though he's in the Ministry of Health, that is still ministry and it's still government. He may have one or two things that he can answer on that. Let me give him the mic.
Thank you very much. And I think from the government side, we have so many opportunities of these digital spaces. And through the innovations that are coming up from different angles, and most of them being funded by different organizations, the ministry is, there is something that we are calling digital health superhighway. And I would encourage everyone who will have access to internet, just try to navigate through that that platform. Just type digital health superhighway. Then all the issues that you want to know about digital health, you'll get responses from there. Otherwise, as I mentioned earlier, we have some strategies that we have laid out through the HICs, through the DHA, that is digital health agencies, and other upcoming strategies. We are able to maybe utilize this to ensure that we achieve universal health coverage with the resources that are available, and of course not making people get like we are making a burden to the citizens. So it is our opportunity to ensure that through this media, we are able to maybe achieve the government's agenda. And of course, the opportunities lies within our fingertips. Through the online systems, we are able to get all these items that we always want, but we also need to consider, to be very careful. We have frauds, we have scams, and if you are very desperate, of course, you will lie to one of them, and later you start blaming that this is the government that we trusted, but you are the one who didn't follow the protocols. Okay? Yeah.
Okay, thank you, Bwana Mtia. Okay, before tuendelee, we had some questions from the high school students. Tusiwafungie nje tafadhali. If you have any question to Dr. Koril, please share out so that he can answer it.
What are some of the challenges that the resource people in digital healthcare face?
Okay, if I can respond to that, of course, we understand everything comes with a cost. There is need for internet, needs for data protection, need for a protocol, the government protocol. Again, I will follow that. Remember, whatever you do online, like in today's world, you are being monitored, so you should be very careful. You may wonder if somebody is seated somewhere and maybe you are throwing threats to either a government official or to someone. Through a minute, you can be assessed wherever you are. So we have so many scams, we have so many opportunities that are there online. But of course, you need to be very careful not to create information that will confuse the public, because if everyone is talking about one thing but they are not aligned together, they will end up confusing the entire audience, hence making people maybe go in a wrong way, or few attending to the positive behaviors. So it is something that affects everyone in the digital space. Of course, access or the need to reach everyone, it is another very big challenge, because it requires a lot of issues or materials, devices to even to target people who are physically disabled. not everyone is on a digital space. So, and your information is more targeting those people. That becomes another issue that you might need to prepare yourself before starting your journey into that space. So we have so many challenges that you may face, but of course, having or laying out foundation before you start either your campaign or sharing your information, you have to ensure that you are very well aligned and work within that means. Yes. Last one?
Yes. What should we do as the public to help in developing the digital healthcare systems?
Okay, very good question. How can you chip in as a public? Of course, because most of items or of the issues that come from the government side or from a national side, you are the beneficiary. And you can help the government or your leaders maybe disseminate the right information, not creating rumors or confusion to your entire people that you are with. And of course, giving feedback. We have feedback mechanism on how we might need to improve our services that we are offering to the public. Of course, we have that opportunity so that we can see how best we can address and reach out to everyone. Yes.
I'd like to probably chip in on that and ask the team to my left or the group to my left here, how many, but if you have the go to Twitter, Facebook, any of the social media platforms, and if there's an issue, you report it, you give feedback. You go to a restaurant, you give a Google review, you go travel somewhere, you give a review. Is the same thing that we need to do in some of these digital systems that are available. And that's one of the ones, because we are the end users. So it's about knowing what is there, what do I need to access as an individual, and giving that feedback so that it is tailored and customized to what we, the most users, need or do. So for example, for me in my organization, we're digital. So we look at our usage, the different social media platforms and including the website. So for example, we find that most people access us on mobile. So what does that tell us? Anything that we do, be it our content, how we design our content on our website, Willow Health Media, how we do it even on our social media platforms, that we have mobile in mind, knowing that 90% of our users are on mobile. And when they give us feedback on how things are supposed to do, we incorporate that feedback. And I think it's the same thing that, you know, when it comes to digital healthcare systems that are there, for example, the one like SHA, it's upon us to utilize that, access, find out what's happening, is it working or not, and give the feedback so that, you know, something is done about it. Thanks.
There's also a question on this side.
Yes, my question is directed to Dr. Korir, and I would like to ask two questions. Since you've said that you have a background in journalism, how did you know that health is your area? Because it's broad. And also, you said we need to know and have what we need to have trusted sources. How do you get these trusted sources? And also, like, yeah, that is it for now.
Okay. Very, very good questions. So the first one is easier. My first training is in medicine and surgery. Then journalism came later on. So it was just about, not really about, it was having done medicine. It's what I actually wanted to do. Not that one of the questions I ever get is if I was forced to do medicine. I wanted to do medicine, I wanted to be a doctor. I did medicine, I became a doctor and practiced. But during that initial time of practice is when I just thought that probably there's something different or else that can be done
with the medicine. So I went to the University of Nairobi School of Journalism and did communication, and that's how I ended up in journalism. So for me, journalism came later, and it makes health reporting, health journalism easier for me because the health content, I know. It was the journalism and the art of journalism that I needed to learn. Part of it I learned in school, part of it, was through on-the-job training. Because when I went to KTN, I started as an intern, as a reporter, and, ended up as an editor. So it was just on-the-job learning to do the journalism so that I'm able to report on the health and the health issues that I understand, that I know from learning it in university, and also just from the practice that I did for about 4 years of being a practicing doctor. How do you get sources? Sources you get along the way. Once you start working as a journalist or as a practitioner, you let me say you get them along the way. It's a bit different for me because some of these sources are people I went to school with or I worked with in the health sector. So for me, it's a bit different, but you get them along the way, because when you're doing a story, you've been told, say, to interview somebody from the Ministry of Health. Mutia is here today, so you'll get his contact if you're in the health field. If ever you need to do anything about a health story, it's Mutia that you'll talk about. So that's how you collect your sources along the way, and you just gather them. It's not like there's a pool somewhere, but it comes with the practice. And then now it's up to you to make sure that you have the right sources. Just like they say, every market has its own madman. So every sector has quacks, masqueraders, and all of that. So it's now up to you to make sure that you have the right people. So for example, if you're looking for a doctor to interview, you just go to the Medical Council website, where all of us who are registered to practice in Kenya are. You just put in a name and you'll be able to see if this person is legit or not. If they're not there, I can assure you they're 100% a quack. So there are some of those things that you just go ahead and verify, but you gather your sources as you start your practice and your work. Yeah.
Thank you. My name is Lydia Mokaya, a member of the faculty. My question will go to Mr. Mutia. It's good that you talked so much about how you do sensitization and advocacy, message awareness, and the rest. And you picked a good example of what is done, especially to expectant mothers. Now, my question is, probably, is the same now done to the medical practitioners and health officials? Because now, if you've really taken care of this mother all along the journey of pregnancy, and then maternal deaths are reported by mostly negligence. And obviously what we are able to see on digital platform would be very little from what is reported ideally in many cases that we are not aware. So where is the disconnect?
Okay, thank you very much. I think because majorly when you are trying to do sensitization or create awareness, it is about preventive and promotive health. And in this case, our mandate is to ensure that first we ensure that our audience or the person whom we are targeting understands the right way of doing something or changing behavior. Then in terms of reporting, of course, there are people who are mandated to report. You might see anything on social media, but when you come to the ground, you find it is totally different. So we have a proper way of getting this data, getting it from verified sources. If it is in terms of death-related information, there's somebody who is custodian to give that report at every level. If it is county level or facility level, of course, now the head of that facility, of course, is the one who is supposed to provide whether this is the right report. And once it is confirmed, of course, now it is posted on the platforms that is the Kenya Health Information System. And now I understand we are shifting from that now to put it in the digital health agency where you can access every information. And through that linkage, we are able to see how are you supposed to give this or access this report, and how legit is this report, because not what is reported online without evidence, of course, is true. So we have to ensure that everyone plays his or her own role to ensure that you don't bring the rumors that we had mentioned and also confuse the entire public, or maybe you want to demean other person, or because this facility is doing better than this one, so you might need to put something that will be seen like you want to finish, or how do we call it, unataka kuharibu jina ya hii facility ingine ama kuachomea. But the good thing is now the system are there. At every level, we have people who are representing whatever indicator the ministry is looking at, if it is maternal, if it is reproductive health, or if it is any other health issues. There are people who are meant to ensure that we get the right information, the right data, and if it is accessible to the public, there is a channel that you are supposed to access this information and get the true data on it. Yes.
If I may chime in, so specifically on issues of maternal death, they are what we call reportable cases, in that any maternal death is reported all the way from, if it's a dispensary, a health center, all the way to the Ministry of Health. And nowadays there's what we call MPDSR, maternal and perinatal death surveillance and response meetings that happen. If one mother dies, you get everyone within the facility, from the doctors, the nurses, anyone who attended to that mother, up to the health management team, the county teams, and the Ministry of Health, so that that one case is discussed thoroughly to find out what failed. And from the reports, you'll be surprised that actually the issues of negligence are actually very few. Our mothers die because of our systemic issues, and I'll give 2 examples. You'll find in Kenya, the biggest cause of mothers dying is bleeding. What does that mean? As a country, we need to have blood banks up to all our facilities, including dispensaries, because some mothers will come and deliver normally in dispensaries. So if they come, because when labor comes, you don't know when labor is coming, and they start bleeding and you don't have blood, what do you do as a healthcare professional? What do you do? You'll obviously try and use what we call normal saline, just the drip, and refer. What if there's no blood where you refer? You're likely going to lose this mother. Where is the failure? It's not with the practitioner, because blood is supposed to be addressed from national level all the way to county level to make sure that money has been put in issues of blood, and make sure that all that cold chain, cooling, everything is there. But unfortunately, the people who run our systems, our politicians, they have other things or other priorities, and we lose our mothers because of systemic issues. The second one is availability of some medicines. If somebody is bleeding a lot, there are certain medicines, and the cost has really come down, that they need to stock in every facility where women are delivering. But you'll find it's out of stock. Why? Because somebody didn't see the need of making sure it's been procured and stocked. So sometimes it's really a systemic issue, such that when you don't have the tools as a healthcare practitioner, what do you do? So in the public's eye, it will be negligence. But now when we start really digging deep and going and following the chain, you find that there's a whole systemic issue that needs to be addressed. And that's why I was saying, for health journalism, health communication, it goes beyond the disease or the death. There's a whole other different conversations that we need to have that would ultimately address where the issues and the gaps are, which if not just Willow but nation standard everyone did, then there would be a proper focus and proper, bringing to the fore some of these gaps, and probably something will happen in the long term.
Okay. My name is Alex Ketua from the Faculty of Information. My concern is public health. Public health is a key sector, and that's why majority of Kenyans or people living in third world countries, because of that lack of that information, people are consuming contaminated food, contaminated water or something like that. Something which has already expired, it is in the market. And because of ignorance, most of us, that stuff is taken, repackaged, brought to the market, and we buy without our knowledge. What is the ministry doing? Because our government sometimes reacts after something has happened. Look at what happened during the COVID-19. I think even today, if you go around, you find that most of the institutions, they are not following the protocols now. Very few of us wash hands. Yeah, they don't care now. But that information was very, very important, because when we wash our hands, we take care of most of the diseases which could affect us. That is one question. The second, what is your advice and action of the ministry and as a government? Because there are so many mushrooming and licensed clinics and also chemists which are selling maybe drugs, and the people are going to the counter, they are buying that. What are you doing to that? Because that is a big contributor to what is happening now. Thank you.
Thank you very much, Mr. Alex, for your questions. Of course, first we need to ensure that our public get the right information. And how you pack the information also matters, because you want to influence their behavior, to understand what is good for their health. If they want to go to the either chemist or supermarket and buy something, how will you differentiate that this product is healthy or it is bad? And again, in terms of government taking measures for those people who are repackaging or maybe trying to go against the ethics of ensuring the safety of our public, we have multi-agency coordination teams that, of course, I will say that is not on my level, but there is that team that is responsible for ensuring that all standards or all products that you are maybe packaging or selling out to the public pass through those safety channels. Those teams are responsible to ensuring that they adhere to that to those protocols. But again, because not everyone gets this information about what product is good for me, we have a role of ensuring that everyone, through any means, gets to understand this is the right product that I want. I can see it has a stamp that is recommended. If it is from the KEBS, yes, this is the product that I want. And we are able to now influence their behaviors, to also advocate or create awareness to the other people who they are staying with, for them to also understand and take action. If you see something or a counterfeit material, you know the channel of reporting or making those people who are going against the ethics getting or action being done to them. So it is a more coordinated approach that everyone is responsible, because not government alone. Of course, I know we like shortcuts. We like, sometimes we may say we need the cheapest, but you don't know that cheap is the one which will cost you. So we need to get that information first, know how to identify the, any commodity or any product that is not well packed, or it is harmful to my health. Then after knowing that there is something that is, there is a bad behavior that is happening in my region, how best can we advocate for the good one, or how can we change this behavior among those who are doing that? So I can say briefly, it is something that everyone needs to come in and ensure that we are all safe. Okay? Yes.
Yes, I also do have another question directed to any of you can answer. I would like you to give us advice that you'll give yourself in the beginning of your career. What will you tell yourself?
Okay, if I can go first, of course, maybe I can give an example of myself. When I was doing my attachment, first of thing, I was very hesitant to go back to my village. Not because I don't like it, but I wanted the exposure. So because I had the opportunity to visit another county, so I managed to go to that county and learn from them. You know, the environment, the people you meet, of course, will influence what you normally do. And adding passion to what you normally do or like, of course, it will be an added advantage to your career. And again, I was telling Barasa during our morning meeting that if you are a student and maybe you have either finalized your studies and now you are in the job market, don't wait to be called, okay? Jitume, okay? Go knock those doors. Ask for the opportunity. Even if they are not paying you, just start by learning what they normally do. Then work hard. After that, even if you leave and say, let me go and try somewhere else, of course they will say, oh, we can see this person is able to do this. Can we now offer him or her this job? So it is something that out of what you set in your mind, how you approach the system matters. So maybe I will just encourage that anyone in this field, don't be or don't look what others are doing and say, I wish I could be like this person. Don't let peer pressure make you not achieve your goals. Focus on your passion and work hard, and avoid anything that is not helpful to your career. Okay, anything that can make you into trouble, like either insulting someone or stealing, or going against the rules of the law. Avoid such items if you want to focus with your career. And of course, you will see even through your hard work, paying itself. Okay. I know we could talk a lot, but I allow to welcome my colleague, Dr. Mercy, to add more.
Thank you. That's a very good question. And I have 3 things for you, and even including the students there. I always say, start with the end in mind. What is your career goal? And it's not to be, say, a doctor. It's not to be a pilot or a journalist. What is it that you want to do with that career path that you are taking? what is the impact that you want in society. And I'll give my own example. Well, I think my end was to be impactful in one way or another in the health space. That could have happened if I was a medic practicing, but it has happened as a medic in journalism. So you start with that. What impact, what do you want to be remembered for? And then you work towards that. And as you work towards that, you also allow yourself the grace to change the course as you move along. So that if you are going to be an engineer, for example, and there are bumps on the way, allow yourself to learn from that bump and then go back to the path that you want. But if you have your North Star, if you have your eyes on the goal, you'll always get there. So start with the end in mind. The second bit is that remember that when you graduate, when you finish school, you all finish with the same degree or diploma or certificate, right? If you're in the diploma of, it's what, public relations and creative advertising, all of you will have that paper. What differentiates you? And what will differentiate you is the thing you are talented in, because not everyone has the same talent or has the same capability. So you could be a really good public speaker. You could be really good in graphics, for example. So that thing that you are good in, you make sure you maximize on it and you build on it, because that's what differentiates you from everyone else you graduate with in the class. When we look at people who have applied for jobs, there are those minimum, you need maybe a degree, a diploma, whatever. But what we look at beyond that is what else have you done that distinguishes you from everyone. So it has to be the thing you're passionate about, the thing that you're talented in. Then last but not least is what Mutia said. Be willing to learn. When I started at KTN, because of course my combination was a bit strange, a medic who wants to come to the newsroom, there was no space for me. But what I did was just ask Joe Ageo that, I'm willing to start as an intern. Don't even pay me. I'll start as an intern. And at this point, I used to work at the county. I had a very plum job with a driver and everything, but I went back and started as an intern, where you learn from the basics. You go to collect news attached to a reporter. And at that point, I was probably more qualified than the people that I was going to the field with. So you need to be willing to learn. Sometimes you need to give your time for free. I know this generation, they're not very patient, but sometimes you need to. And then when you are in there, you make sure that you really work hard. You make sure you stand out such that when your internship is over or your attachment is over, the organization wants to retain you, not you even asking for it, and that's the position you want. So you make sure that you work hard when you get that opportunity, and that's the only way that you'll advance. And if you do that, I think you'll be able to go places and be able to differentiate yourself from everyone else who is in the space that you are in. Thank you.
Okay, thank you very much, our distinguished guests. As we finalize this panel discussion, I want to congratulate you all for making your time to be here to share with us your thoughts on digital health communication and universal coverage. So at this time, may I take this chance to welcome Mr. Kembero to share with us something. Welcome, Mr. Kembero.
Let me take over. First of all, wacha niwakumbushe, my name is Happiness Ombaki, and I was the MC for today. Thank you very much for this discussion. We are really thankful for sparing your time to come talk to us about the digital healthcare, because the world is evolving, and everything will be tech-wise from the next even 3 years, even right now. So thank you, Dr. Korir, for sparing your time. Thank you, Mr. Francis Mutia, and thank you, Madam Evelyn. Thank you for that. So before we finish, we also have a vote of thanks from one of our students, and I'm going to pass it over to Victoria Gidinji.
Good afternoon, everyone. My name is Victoria Githinji. I'm a student of the APR, and mine is just to say thank you for gracing us with your presence at our event. Dr. Mercy, Mr. Francis, and Madam Evelyn. I believe everyone here is living with some kind of knowledge from them. And thank you to everyone who participated, to our students from Highway and our fellow students from Kenya Mass. Thank you for asking questions and being interactive. We all appreciate it. And I want to also thank our MC, Happiness, and our moderator, Barasa. You guys have done a really good job. Thank you for moderating this event, and I wish you all a blessed weekend.
Sasa ni lunch time tukulewa. Yeah, so as you can see the time najua mnasikia ni kama tumbo imenini, but we have a bite for you, so the ushers will lead you as you also leave, and I think I should lead with a prayer first of all before we finish. Okay, let's bow our heads for word of prayer. Father God, we thank you for this event. Father, as we have finished right now, Father God, we thank you that, Father God, you have come out with knowledge from this place. And also as we are going to take a small bite, Father God, may you please bless it and bless the hands that have made it. And the ones who are going to take it, please bless them. In Jesus' name we pray and believe. Amen. In the name of the Father, and the Son, and the Holy Spirit. Amen. Okay, thank you very much. Oh, we have Mr. Kemero.
Thank you. Thank you, Happiness. Thank you, Dr. Korir, for sparing your time. I was fearing because of your request, but thank you for your indulgence that we have been able to complete this process. I want to say that there is another program coming in, and I've been requested as students you stay put, as our Vistas leave. Director is coming with another Vista. This time I want to leave this to Mr. Wangombe to take over the rest of the program. Thank you so much.
Naam, wapi makofi ya Daktari Mercy Korir pamoja na Bwana Mutia pamoja na council member Evelyn C. Koyan pamoja na wahadhiri ambao wako hapa, wanafunzi, wageni na wenyeji ambao tayari mmeshadunga kwenye majukwaa yetu mahala hapa. Japo sitoshi, lakini kwa majukumu niliyopewa naomba pia kuwapa kongole kwa namna ambavyo mmeshiriki sako kwa bako ili kuweza kuhakikisha kwamba shughuli hii imetia fora jinsi ambavyo imetia fora kulingana na nami kama msikilizaji na mtazamaji. Asanteni sana. Wanasema sarafu ina pande mbili, tunakwenda kwa upande wa pili wa sarafu, na basi nitakuwa naichangia na kuichanganua ratiba hii rasmi kwa mujibu wa namna ilivyopangwa. Kipindi kinachofuata sasa, kwa heshima na taadhima kuu, mnapoondoka tunasema asanteni sana, manake ni wachache wa aina yenu. 13/3/2026 Ijumaa ya Mungu namna hii. Asanteni sana. Na DPR, asanteni sana pia kwa mbwembwe na shughuli ambazo zimetia fora hapa. Tunasema asante sana. Shughuli itakayokuwa inafuata, ndugu wapenzi, ni kwamba kuna mgeni ambaye tayari kesha wasili, ndugu Michael Pundo ambaye ni CEO Kenya Cultural Center. Yuko pamoja nasi katika maeneo haya, na sina shaka kwamba pale alipo anatesa nyasi, na baada ya muda usiokuwa mrefu atakuwa anafika hapa kwa mikiki na mikuki, ama ukipenda kwa wingi na ustadi wa hali ya juu, wakiwa wameandamana sako kwa bako na mheshimiwa mkurugenzi ndugu Peter Wakoli. Na shughuli ya kwanza itakuwa ni kupanda mti katika ile hali ya kutia kumbukumbu ya shughuli hii, na baada ya hapo basi atakuja hapa nyuma ya bomba na atatupatia nasaha fasaha. Kisha baada ya hotuba yake tutakwenda kuguza cha mchana. Kwa wale ambao hamjafunga, mtakwenda kuguza cha mchana, kisha tutarejea hapa kwa workshop inayofahamika kama talent monetization hapo saa 8 hapo saa 8. Kwa hivyo tuendelee kuwa pamoja. Naam, nafahamishwa kwamba talent monetization inaendelea kwa TV studio, kwa hivyo mambo yanakwenda mubashara mbili kama ambavyo inastahili. Kwa hiyo wale ambao mnatembea tembea, hakikisheni kwamba mmeketi chini ili angalau mgeni wa shughuli hii atakapowasili akute kwamba tumetulia, manake wanasema wenyewe kwamba mgeni njoo mwenyeji apone. Wanafunzi wa Highway Secondary, asanteni sana kwa kuwa mko hapa. Wanasema wenyewe kwamba mmejaa kama pishi la ubwabwa na mmeketi mkao wa kula. Nataka kuamini kwamba PHO atakuwa anatoa angalau maji ama sharubati, ukipenda maji ya rangi, kwa sababu ya namna ambavyo mmetulia. Wanasema wenyewe chanda chema uvikwa pete. Vijana wa jana na vijana wa leo wanasema kwamba mtu ukishaoga kujipodoa si dhambi. Wako wapi? Hii ni niyo inastahili kuja hapa mbele ili angalau tuweze kujipanga. Wapi watu wenye nguvu waweze kuinua hii podium ikuje hapa. Hii meza nafikiri iondolewe hapa, tujipange halahala, alafu tujue tunakwendeje, manaje moja na ingine inakuwa mbili, ili tuweze kufahamu kwamba mambo yanakwenda namna gani, ili tuweze kujipanga halahala. DJ, sijui kama niko na matangazo, lakini lazima tuweze kuketi kwa namna inayostahili. Wale ambao wamesimama kwenye baraste ambayo waheshimiwa watapitia, tafadhali naomba mjipe shughuli kwa kwenda upande mwingine, ili watakapofika hapa kutesa nyasi pamoja nasi wakute kwamba tuko tisti kama boriti, tayari kuweza kusikiliza nasaha fasaha watakayokuwa wanatupatia mahala hapa. Wanafunzi mnaoendelea na masomo, ananiambia babu yangu kwamba sikio sikivu ni tamaa ya mtu yoyote mwenye busara. Kwa hivyo ukiona mwenzako anafanya namna hiyo, ujue kwamba labda ana masikio ya kumaridadisha kichwa, lakini si ya mtu mwenye busara. Nimesema kweli? Haya basi, tunasubiri ili tuweze kuhakikisha kwamba mgeni rasmi katika shughuli hii ameweza kuwasili. Nafahamishwa kwamba tayari yuko katikati yuko pamoja nasi, na nasubiri tu baada ya muda mfupi aweze kushuka. Na muona mheshimiwa mkurugenzi anakanyanga 2233 akiwasili kuja hapa, lakini nafahamishwa kwamba shughuli ya kwanza itakuwa ni upanzi wa mti, na ikiwa hayo yatakuwa yamebadilika basi pia tutawafahamisheni, manake naona wanakuja moja kwa moja kuweza kufika hapa kwenye majukwaa yetu, ili tuweze kuwafahamisheni ni yapi yatakayokuwa yakijiri mahala hapa. Nafikiri kwa sababu ya heshima yao naomba muweze kusimama. Simameni kwa sababu hapa wanakuja watu ambao ni wazito. Niliwafahamisheni awali kwamba kimo, yani urefu ama ufupi, ni kazi ya Maulana, lakini kunenepa ama kujikondea ni bidii ya mtu. Je, jinsi tulivyo, bidii yako iko wapi? Haya basi, kama nilivyowafahamisheni ni kwamba anakuja mtu mzima, ndugu Michael Pundo ambaye ni CEO Kenya Cultural Center. Baada ya muda usiokuwa mrefu atakuwa hapa anatutafunia nasaha fasaha, na baada ya hapo tutakwenda kwa chamcha na tutaweza kurejea hapa baada ya chamcha, kisha tuweze kuendelea kuichangia na kuichanganua ratiba hii kwa mujibu wa namna ilivyopangwa. Kwa wageni na wenyeji, kama nilivyosema hapo awali, japo sitoshe, lakini usije ukaona wembamba wa reli, manake gari moshi upita. Tutaisogoresha na kuichangia na kuichanganua ratiba hii rasmi kwa mujibu wa namna ilivyopangwa, ili angalau tuweze kuhakikisha kwamba mambo yanakwenda barabara. Upande wa pili wanaumwa sikio, si kwa nia ya kujeruhiwa, lakini kwa nia ya kufahamishwa mawili matatu, kwamba mkurugenzi alipokuwa pembeni walikuwa wanatesa nyasi wakielekeza upande upi. Mambo mawili matatu, ili kisha baadaye waweze kujiunga nasi kwenye majukwaa yetu mahala hapa, ili tuweze kuwapokea kwa namna inavyostahili. Asanteni sana kwa sababu ya kusikiliza wito. Sijui kama magoti yataanza kulalamika, manake tumesimama muda, lakini tunaomba subra kidogo. Baada ya muda usiokuwa mrefu, sina shaka kwamba watakuwa wanajaajaa kama pishi la ubwabwa ndani ya majukwaa yetu mahala hapa. Karibu sana mheshimiwa mkurugenzi, naona tayari ushafika. Ama kwa kweli huyu ni mtu mwenye bidii sana, bidii ambayo mkiniruhusu nitailinganisha na bidii ya mtu wa kujenga kichuguu kwa mate. Mheshimiwa mkurugenzi, nafasi tulionayo haiwezi kumruhusu kuku kumeza punje. Kwa hivyo ningeomba tu uweze kutamalaki bomba ili uweze kumkaribisha mgeni mheshimiwa ambaye ni ndugu Michael Pundo ambaye ni CEO Kenya Cultural Center, pamoja na yote yatakayokuwa yakofuata. Japo sitoshi, lakini kwa majukumu niliyopewa, karibuni sana.
Thank you, thank you, thank you. Please be seated. Please be seated. For the last 1 hour, we have benefited from a discussion from expert persons who've just stepped out. I hope you've gained something. Did you pick anything from that discussion? Yes. Extremely, very informative. We could do some follow-up from wherever we were, and we were able to find it extremely, very instructive. Now, the persons who seek for careers and professions in mass media and communication always thirst or yearn for an opportunity to see where they can apply these skills they learn. Now, those platforms for persons from this category are not so many. The Kenya government has been able to put in place a number of initiatives that helps our young people to see and to be able to showcase their skills. One of the facilities available and agents available is our Kenya National Theatre, which gives us a gateway and a pathway to many of the things we learn. There are things you create and you have no idea where to tell the world that you know these things, and they can be able to confirm that you're actually an expert. It is not easy to get to some of these places. And so, as an institution, Kenya of Mass Communication, we have a responsibility of being able to reach out to these institutions, and hopefully, shortly in the near future, we'll be able to have a structured program and framework where we can all work together to give you a chance who are here today to showcase what you learned for 1 year, 2 years, or 3 years while at this institution. The employer will not know you, the consumer of your product will not know you unless you have a platform to showcase what you know best. And today, this afternoon, I guess it's an afternoon, in our midst, it's 4 minutes past 1 o'clock, in our midst, we have the Chief Executive Officer of our National Theatre who has come to give us hope and inform us that what you are studying here is not in vain. There is value addition that his facility can be able to provide. And I'm excited to have Michael here with us because he's a brother and a partner in what we do here at Kenya of Mass Communication. I want you to prepare to welcome Michael with what I may consider as a clap by persons who are in the media industry. Danish, how do we do that?
Thank you, thank you, thank you. We'll give our chief guest 3 rounds of applause. So we start.
Thank you very much. My brother, please come and speak to these young, very creative people.
Thank you so much, Director. The Director, Kenya Institute of Mass Communication, members of the faculty and staff, distinguished guests, students, ladies and gentlemen, good afternoon. As you've been told, my name is Michael Pundo from the Kenya Cultural Center. I want to start by saying that it is a great honor and privilege to join you today as you celebrate this cultural day. First, I bring to you greetings from the Kenya Cultural Center, which is the home of the Kenya National Theatre, an iconic space in this country, where our mantra is inspiring creative connections. And it is a place that is dedicated to nurturing creativity. We also preserve heritage, and we celebrate the diversity of artistic expressions, which are very key in defining who we are as a nation. First of all, I want to congratulate the leadership of this institution, the organizing committee, the students, and everybody else who was involved in putting together this important event. As we all know, cultural days are not just mere days of performances or costumes or seeing traditional food, but they are powerful circumstances for identity, heritage, and also a showcase of our unity. We also know how Kenya is rich in our cultural heritage, based on the diversity we have in terms of our traditions, our languages, our music, our artistic expressions, which are remarkable and worth celebrating. As we gather today, we are reminded that our diversity is far and foremost our strength, but also something we need to pride in, because our cultures give us a sense of belonging and also tell story of who we are. And so in terms of storytelling, as communication experts, I want to believe you are, or people training to be communication experts, you have a special responsibility. Because you are storytellers of our generation and generations to come, through journalism, through video, through radio, through photography, and even through writing, you will have to document the realities of our society and also shape who we are in the eyes of those who watch you, but also in the ears of those who listen to you. And so the media plays a very critical role in safeguarding culture, because it captures our traditions, it records our history, and it shares our stories, which might otherwise have been forgotten. I therefore encourage you to use this platform not only to inform and entertain, but also to celebrate our cultural heritage and give voice to diverse communities, but also tell our stories through our eyes. At Kenya Cultural Center, we support artistic development. We are ready to support you because we know in this team there are artists, there are performers, there are filmmakers, and there are also creatives of different capacities. Through theater productions, art exhibitions, festivals, and various programs, the Kenya National Center and through the Kenya Cultural Center will provide a platform for talent to grow and also for our cultures to thrive. But culture will not only thrive in theaters alone. Culture lives in our homes, in our languages, in our music, and in our storytelling. That is why it is important that events like this give young people the opportunity to connect with their roots and express those connections in creative ways. Allow me to tell you that as a nation, we value the strength our culture gives us. We celebrate it, we promote it, we respect it, but more importantly, we need to understand it. As we normally say, I'm Henga today, utamaduni wetu ni utambulisho wetu. we must live that, because that also resonates to what we normally say, bila utamaduni taifa hupoteza mwelekeo wake. And so the onus is on the students here to ensure that we don't lose what we have for posterity. I want therefore to urge you to embrace creativity, innovation, while also remaining proud of who you are. We all know that culture is dynamic, but traditions are static. And so it is important that we find a bridge between the dynamism of culture and the static nature of our traditions, because then that will define who we are in the future. As I conclude, allow me to once again commend the organizers of this day for creating a platform where diversity is celebrated and talent is showcased. Your efforts contribute to the strengthening of our national pride and in the appreciation of our culture. Kenya Cultural Center is proud to be connected to Kenya Institute of Mass Communication, because as an institution, we are a gateway to you showcasing what you have studied at the college. As we enjoy our performances and exhibitions today, remember that each song, each dance, each costume displayed, and each story represents a generation, represents our history, and represents our heritage. Let us celebrate together in pride. Let us tell our story and not allow anybody to distort that story. It is important that I'm talking to communication experts and who will always have the mic. Know the importance of when you hold this mic and the story you tell, because majority will believe your story. Thank you.
Pigieni makofi. Naam, asante sana Bwana Michael Pundo kwa kuweza kuelekeza. Naam, asante sana Bwana Michael Pundo kwa kuweza kutoa nasaha fasaha. Ningeomba kwamba tuweze kufahamu kama ule mti wa kumbukumbu uko tayari, ili mheshimiwa aweze kwenda kupanda angalau mti huo, ili kesho kusije kukawa na yani ama hatiati, nani kaja wapi, nani kasema nini na kadhalika na kadhalika. Manake katika hafla za aina hii hatubahatishi wala kubabaisha. Unafahamishwa kwamba mheshimiwa mkurugenzi, mti uko tayari. Kwa hiyo ndugu Denish, naomba muweze kuandamana na Bwana Pundo ili kwenda kuhakikisha kwamba mti huu umepandwa. Alafu baada ya chamcha tutaweza kurejea hapa na kuendelea kuichangia na kuwachanganua ratiba rasmi kwa mujibu wa namna ilivyo. Mtakubaliana nami kwamba ndio mwanzo tu, mkoko umealika maua katika ile hali ya kuichangia na kuichanganua ratiba rasmi. Kwa hivyo mambo bado. Hapo mlipo kamateni chamcha kisha tuweze kurejea mahala hapa. Nitauliza swali kwa sababu ya Highway Secondary, angalau muweze kupata sharubati ya maji ya rangi mkipenda. Kwa hiyo DJ, tunaomba uweze kuweka kitambulisho cha ngoma tunaposhughulikia mambo mawili matatu hapa. Asanteni sana kwa kuweza kuandamana nasi kuanzia asubuhi hadi sasa, na tunaamini kwamba hata kuanzia saa 8 tutaendelea kutembea pamoja sako kwa bako hadi pale tutakapolikunja jamvi kwa siku hii ya leo. Na nikukumbushe tu kwamba hii ni siku ya 3, ya 4 itakuwa ndio kesho, na pale ambapo itakuwa ni papo kwa papo kamba kukatajiwe, manake hapo ndipo tutakuwa tunatia tamati katika shughuli hii za Culture Week. Kwa hiyo karibuni sana ili tuendelee kutembea kwa pamoja. DJ